Hello everyone, welcome back to UWorld's Next Gen NCLEX review. My name is Nicole. I'm a nurse here at UWorld, here with another question drill set. If you are new and don't know how a question drill set works, well, welcome in, glad to have you, glad you stumbled upon our page, or maybe thank you for coming back. How a question drill set works is I will pull up a question here now above me, give you about 30 seconds to review it, think about the answer choices. I give you some time to drop your answer choices in the chat, and then I go over why the right answers are right and then the wrong answers are wrong. And then we just get in a good practice of maybe different keywords that we should be looking out for in the question, and then just different things to look out for in general with different NCLEX test taking tips. So today's topic is prioritization and delegation. So we'll start off with a couple questions with prioritization and try to figure out what things that we should be looking for with priority type questions. And then we'll move on to some delegations based off different scopes of practice between an RN, LVN, and a UAP. So without further ado, let's get started. We have Nurse Samantha in the chat moderating for us today. So if you have any questions or I go a little bit too fast and you need some reiteration on things, just drop her a question in the chat and she'll be sure to answer. So let's get started. The nurse is caring for assigned clients. The nurse should first assess the client who has what? Option 1, has pneumonia and a temperature of 100 degrees Fahrenheit. Option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. Option 3, has ulcerative colitis and severe abdominal cramping. And option 4, has a history of a stroke and is unable, to lift the arm on the affected side. Sorry, got the burps. Let me know what you guys think in the chat. Hello, everyone. So many people saying hello. Good to see you guys. Sorry I missed you guys last week. I actually missed going live with you guys, but I hope y'all enjoyed Nurse Jasmine and Nurse Rebecca on the lives. We're trying to incorporate and get more people on the live. So let me know how you guys enjoyed them. Good job, and lots of good answers in the chat, as always. Y'all are always ready to go. Hello, everyone. Hi. Good stuff. Well, I think y'all got this one. I feel like I always start you off on a good foot, which is good because it's pretty unanimous in the chat. It is option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. So the reason why we're assessing this client first, because this client is keen towards sepsis. So it has two identifiers towards the sepsis protocol, which is that identified infection, which would be the cellulitis, and then the heart rate of 130 beats per minute, which we know is tachycardic and not in our normal range. So this is keen towards sepsis, and we know sepsis can very quickly escalate into something worse, as in septic shock and possibly even MODS, which is multi-organ dysfunction or failure. So we need to quickly do some interventions to get them out of this sepsis protocol, give them antibiotics, give them fluids to kind of bring that heart rate down, treat the infection, and prevent any crisis from happening. Options 1, 3, and 4 are kind of expected findings and not triggering for an immediate intervention. It's not life-threatening. So option 1, has pneumonia and a temperature of 100 degrees Fahrenheit. While this is a slightly high temperature, it's not technically febrile for us to give like Tylenol or so we could just do ice packs for cooling measures. And it's expected for a client with an infection to have a low-grade fever. Option 3, has ulcerative colitis and severe abdominal cramping. Again, an expected finding with ulcerative colitis. They're going to have that abdominal cramping, especially with a flare-up. And then option 4, has a history of a stroke and is unable to lift the arm of the affected side. Again, an expected finding of someone who has a history of a stroke. That is that hemiplegia happening. But you guys did good. Question number 2, the nurse is caring for assigned clients. The nurse should first assess the client who has what. So again, try to figure out the first immediate client that they should see. If we don't intervene quickly, would it cause life-threatening situations? Think about your ABCs. These are some things that you think about when you're doing prioritization questions. So option 1, has a femur fracture and altered mental status. Option 2, has a hip fracture and a discrepancy in leg length. Option 3 has osteomyelitis and reports pain rated as 9 on a scale of 0 to 10. And option 4 has a lower leg amputation and reports paresthesia in the amputated foot. Let me know what you guys think in the chat. Also, let me know if we have any recent NCLEX passers or NCLEX schedulers. So if you plan to take your NCLEX in the next couple of weeks, I would love to wish you congratulations or good luck. Get those endorphins going and give you a little shout out. So let me know anybody in the chat that is scheduled to take their NCLEX soon, or you passed your NCLEX using UWorld and you came back for more. Let me know in the chat. I see lots of great answers with great rationales. Good stuff. Good. We have Mia on Instagram, takes hers next month. Good luck to you. Someone's taking theirs September 29th. You're about a month out. Good luck. Get that last minute studying in. Doug is taking his on October 8th. Someone just bought the UWorld material yesterday. You're in good hands. And I see lots of great rationales of the correct answer, which a lot of people are saying fat embolism, which is true. Option 1 has a femur fracture and altered mental status. Yes, this is keen towards fat embolism, which happens when you have a fracture or a break of a long bone. That bone has a lot of fat in the actual bone marrow. And if that travels in the blood circulation, it can occlude some of those tiny vessels, especially those tiny vessels in the brain, causing that altered mental status. So this would be our priority. Altered mental status is pretty high up there with any prioritization questions, maybe after those ABCs, because we're knowing that something is being altered and is wrong. Option 2, 3, and 4. Option 2 has a hip fracture and this discrepancy in the leg length. This is kind of to be expected, especially if they haven't fixed the hip fracture. So a discrepancy from the hip. That sounds pretty reasonable. Option 3 has osteomyelitis and reports pain rated as a 9 on a scale of 0 to 10. Again, osteomyelitis is that infection of the bone. This is an expected finding. Unfortunately, yes, pain is something that we need to assess, but it doesn't go as high as someone with a fat embolism and altered mental status. And then option 4 had a lower leg amputation and reports paresthesia in the amputated foot. This is unfortunately something that can be expected. Not all amputated clients have this pain or paresthesia, which is called phantom leg pain or phantom arm pain, depending on the amputated part. But it is not a new crazy finding to see. Is they used to have a limb there and now they don't. So now the body's trying to feel something that's not there. It's kind of confusing, but is an expected finding for a newly amputated client. So the only one that is a complication and not a slightly expected finding would be option 1. But you guys did very good on that. I need to get harder questions for you guys. Next question. The nurse is caring for assigned clients. The nurse should first assess the client who has what. So again, think of it. Is it an expected finding or is it a complication? Which one of these would be priority and cause life-threatening situations? Is it ABC situations? Is it, just complications? So option 1, acute myeloid leukemia is receiving chemotherapy and is reporting alopecia and anorexia. Option 2, esophageal cancer is receiving external radiation therapy and has warm red skin on the neck. Option 3, aplastic anemia is scheduled to receive 2 units of packed red blood cells and is reporting fatigue and pallor. Option 4, Hodgkin's lymphoma is scheduled to receive chemotherapy and has distended neck veins. Drop your answers in the chat. Let me know what you guys think. I'm already seeing lots of 3s and 4s. Or maybe that was for the last question. Oh, no. Well, 3 and 4. 3s and 4s. Let me see if I can maybe help you guys with what is an expected finding. That's the only thing I can gear to? What is an expected finding with the diagnosis versus what is a complication of the diagnosis? Good job, guys. I'll give you a couple more seconds. This one was kind of longer, so you might have already had time to think it through. Good job. Now someone said switching it to blank. Still a good amount of 3s and 4s. So let's talk it through. Expected findings, which would be options 1, 2, and 3, versus complications, which would be option 4, that Hodgkin's lymphoma. If they're receiving chemotherapy and have distended neck veins, this is actually a complication. Those distended neck veins are keying towards maybe a tumor or something compressing on that superior vena cava that is altering the blood flow from their head and to their heart. So this is a huge, huge, huge medical emergency, and we need to get that tumor out or just relieve the obstruction that is hindering the blood flow. Yes, this is the only complication. Option 3, which is what a lot of you guys also chose, aplastic anemia, is scheduled to receive 2 units of packed red blood cells. So we know anemia is loss of blood in whichever form, and so they're receiving 2 units of blood, packed red blood cells, which is what we need to do to fix the anemia. And then a client that is reporting fatigue and paler, this is an expected finding of anemia. They don't have those blood cells to transport all the oxygen to the needed organs or their extremities. So they're going to have paler skin, their fingers might be a little bit blue, they're going to have a lot of fatigue because they don't have free-floating oxygen going around because they have less blood cells running in their body. So them receiving 2 units of packed red blood cells is a thing that you would see, an expected finding, and an expected finding to be fatigued and pale. So that is incorrect because that is expected. Option 2, esophageal cancer is receiving external radiation therapy, so that high beam radiation to the neck because it's esophageal. So those are all expected findings. Red skin on the neck. All of that works well together. Nothing is concerning in that. And then option 1, acute myeloid leukemia, is receiving chemotherapy and reporting alopecia and anorexia. So with chemotherapy, we have a lot of side effects. And one of those things can be alopecia and anorexia because they just don't have the energy to eat and they lose a lot of weight and they get sick a lot. So it is an expected finding of as a symptom of chemotherapy. So correct answer is option 4. Good job, guys. Okay, next question. The nurse is caring for a client who is experiencing thyroid storm. It would be a priority for the nurse to do what? So if we're doing one thing to save their life, or if you're thinking of all the interventions to treat someone with a thyroid storm, which would it be? Would it be option 1, initiate beta blocker therapy? Option 2, administer radioactive iodine? Option 3, maintain the client on NPO status. Or option 4, place a warming blanket on the client. Let me know what you guys think. Good job, guys. Someone said this was on my HESI exit exam yesterday. Well, I'm glad you learned something. Hint, hint. Good job. You got it right. Lots of good answers in the chat. Good job, good job. I'm seeing a lot of 1s and some sprinkles of 3s and 2s. Someone said, I learned the answer from UWorld. You're learning something good from us. I'm glad. Good job, good job. For the most part, I see majority of these, someone, Sevile on Instagram. It's pretty funny. Most of you guys got the correct answer, which would be option 1. Then there was the sprinkles of those 3s and 2s. So let's get to the root of the problem, which is that thyroid storm. That thyroid storm is like a hypermetabolic state in a person's body, like severe hypertension. So think of everything working on overdrive. You're going to have a super fast heart rate. You're going to have super high blood pressure. You're going to have some cardiac dysrhythmias, altered mental status. Everything is high, high, high and dry. So the way to treat all these hypermetabolic, like severe hypermetabolic things is to give anti-thyroid medication and to cool the body down, try to relax the body. So initiating beta blocker therapy, which we know beta blockers slow the heart rate, slow the contractility, and make your blood pressure slow down. This would be good for something that is going super, super quick and revved up a lot. So beta blocker is the only thing in these answer choices that would slow everything down. Option 2, administer radioactive iodine. This is not really a treatment. This was just a straight up distraction type of answer, not used at all with a thyroid storm. Option 3, maintain the client on NPO status. That also is not going to change the situation of the thyroid storm or the hypermetabolic state. So again, another distraction. And then option 4, place a warming blanket on the client. This would be the exact opposite of what we want to do. They're already high, high, high in drive and revved up with that metabolic state. So we actually want to do the opposite by giving them a cooling blanket, giving them ice packs, doing a dark, serene room so everything can be relaxed and slow down. So option 1 is the only thing that's slowing things down. So good job, guys. Okay, so now we're going to get into some delegation type questions. So take a moment to review everyone's scope of practice. We are future RNs here, so make sure you understand what the RNs do in the hospital, in the outpatient setting. What RNs are normally in charge of is beginning things and ending things, and then initiating things as well. So clinical assessments. So if things are changing, we want to be the first person to assess those clinical changes. So with the clinical assessment, option 2. The next thing, client education, initiating client education and initial. So these are all the things in the beginning. Anything with education, the beginning and end always, always, always needs to be the nurse. So we can make sure it's a full therapeutic circle and they're truly understanding. So that little check mark at the end of your care plan where they say verbalizes understanding, you can actually check it off in good nature. Same with discharge education, everything at the end to make sure they fully understand everything. Clinical judgment, which also goes with any changes that might happen after like a procedure or after giving any medication. And then initiating blood transfusion. This is a very big thing. It's something that they like to test a lot on the NCLEX is blood transfusion stuff that is mostly RN scope of practice. LPN is everything in between. So they monitor the things that the RN found and do those serial checks. They reinforce the education that the RN did. They do the routine procedures. They can do most medication administrations. They can't do IV push medications, but they can do pills and they can do subcutaneous. But IV push, that also comes with extra assessments, which is where that clinical assessment comes in with the RN. So they wouldn't be able to do those IV push medications. Ostomy care, tube patency and feeding, and certain specific assessments, which are listed down there at the bottom. The UAP does everything of activity of daily living. So think of all the things that just 5 extra minutes that I could do, but if I delegated it to the UAP, I would have a much easier shift. So taking them to the bathroom, cleaning them up, all the things that we sometimes take for granted, but those UAPs really, really do help. So let's get into our first question. The nurse and unlicensed assisted personnel, the UAP, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? Option 1, assisted 2-day post-operative hip arthroplasty, mouthful, client with morning care. Option 2, collect a urine specimen for culture and sensitivity from a client with a Foley catheter. Option 3, irrigate colostomy of a 2-day post-operative colostomy client who is stable. Or option 4, refill the empty enteral feeding container with tube feeding. Let me know what the UAP can do. Let me know, let me know. And we're halfway through, a little bit past halfway through, so I can ask my favorite question that I like to ask every week. Where are you guys tuning in from? I love to see how far UWorld reaches. I went to a conference this past week and I felt like there were so many people within the United States, but I got to meet some people from Australia and people from Africa. Let me know in the chat where you guys are tuning in from. Miami, Texas, California, Atlanta, Ghana, New York, Washington State, South Africa, Nebraska, Kenya, Florida, Bakersfield, California, Toledo, Ohio, Arizona, Maryland, Hawaii, New York, San Diego, Connecticut, couldn't pronounce that place in California, Trinidad, Puerto Rico, London, Orlando, Kenya, Philippines, international nurse from India, Haiti, Tyson, Virginia, UK, Cameroon. Hi from the US of A. Hello from the other part of the US of A. Finland, St. Louis, Missouri, Brooklyn, New York, UAE, Nepal, New Jersey, Eritrean, South Carolina, Indianapolis, Houston, Texas, H-Town, Zambia, Philippines. Someone's taking their NCLEX next month. Good luck to you. Toronto, Hungary, Nepal, Sacramento. Lots of people all over, both domestically and internationally. So hello from all over. And if you are scrolling late night, I hope you go to bed after this, okay? All those international people. Nice to see you guys. Thanks for tuning in. Okay, correct answer for this one would be option 1, assisted 2-day post-operative hip arthroplasty client with morning care. So like I said, the UAPs do a lot of the routine things, the daily living on stable clients. So this client is stable. We have nothing to see that, or nothing shows that they're unstable. They're 2-day post-operative, so they're actually probably getting up and trying to be mobile, and they're just doing morning care. So that's like brushing their teeth, getting dressed for the day. So nothing that requires any assessment or any follow-up or anything. So this would be totally appropriate. Option 2 would be incorrect because collecting a urine specimen for culture and sensitivity is actually considered a sterile procedure. So that is something that the RN actually has to do. If it was like a clean catch or a midstream, that is something that they would be able to do because hopefully the client can maybe help them with that and it doesn't need that sterile procedure field. But since this client is asking for a culture and sensitivity, that is sterile, so only an RN. Option 3, irrigate a colostomy of a 2-day post-operative colostomy client who is stable. So yes, although this client is stable, irrigating a colostomy bag, this is something that is in the scope of practice for a nurse. 1, because 2 days post-operative, things can quickly arise, but 2, it's just irrigating and for an invasive procedure, and we don't want to do that for a new client with a new ostomy. So irrigation, invasive, not for a UAP. And then last one, option 4, refill the empty enteral feeding container with tube feeding. While this is considered a feeding, again, this is an invasive thing to do because they have tubing and things connected to them. This would be something that the RN or actually LVN would be able to do, not a UAP, since there's connections, tubes, and assessments and documentation. So not this one. Next question. The nurse in the intensive care unit is caring for a client who is mechanically ventilated with a tracheostomy tube. Which of the following activities would be appropriate for the nurse to assign to the UAP? Select all that apply. So think of all the scope of practice things that the UAP can do. Think of all the things that you would ask the UAP to do. Your certified tech, your technician, CNAs, whichever part of the country you call it. I was a travel nurse for a long time, and I felt like everywhere called it different. Option 1, apply moisturizing solution to the oral mucosa and lips. Option 2, clean the area around the tracheostomy or stoma with normal saline. Option 3, educate the family to maintain the head of the bed at least 30 degrees. Option 4, obtain and document respiratory rates and pulse pulse oximetry readings. And option 5, perform passive and active range of motion exercises. Let me know what you guys think in the chat. Good job. Good job. Let me scroll up a little bit and see what I missed. Someone saying good morning. Oh, it's about to be good night for us. Lots of good answers. Someone said all of the above. Let me give you a little hint. On the NCLEX, and usually with us as well, since we like to mirror the NCLEX as closely as possible, with a select all the apply question, it will usually never be all of the above. There's at least going to be one wrong answer. So maybe you want to change your answer now? Good job, good job. Someone on TikTok says UAP cannot educate family, not in their scope of practice. Pretty good. Uh-oh, I'm on the wrong thing. Correct answer with that. So correct answers are options 1, 4, and 5. So think of those activities of daily living, things that for the stable client to just make them more comfortable, and things that they would maybe normally do without them being in the hospital. So option 1, applying moisturizing solution to the oral mucosa and lips. So applying chapstick. That doesn't take any interventions or assessments, so that's totally okay. Option 4, obtaining and documenting respiratory rate and pulse oximetry readings. Again, you're not intervening, you're just documenting what you're maybe seeing. Since they're mechanically ventilated, they're probably on a monitor. So you're just writing what you see, which is okay to do. And then if you're seeing something that is bad, then you can relay that onto the RN. But just obtaining and documenting, totally fine. Please do that. I need someone to write my vitals. And then option 5, perform passive and active range of motions. As long as they're not flipping and twisting and doing all the crazy things that maybe PT might be doing, active and passive would be like the Q2 turns, the offloading of the heels and stuff to kind of keep their body moving and prevent pressure ulcers. That's totally okay. Options 2 and 3 are incorrect. Option 2, clean the area around a trach stoma with normal saline. That can get pretty scary. Even me, I'm still a little scared of trachs. So you want the respiratory therapist or the RN to do any dressing changes. And then option 3, educate the family to maintain the head of the bed at least 30 degrees. Again, educating, like someone said in the comments, is something that the RN is supposed to do. We can reiterate it, but we don't want to do the initial education of why we need to maintain that. So y'all did great. Y'all did great. Next question. The nurse and licensed practical nurse, the LPN, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the LPN? So now we're away from the UAP. Now we've moved a little bit higher up with the LPN. Select all that applies, so more than one right answer. Option 1, create a plan of care for a client with chronic stable angina. Option 2, measure a client with heart failure for anti-embolism stockings. Option 3, select discharge teaching topics for a client with atrial fibrillation. Option 4, administer enoxaparin to a client who's receiving skeletal traction. And option 5, apply a sequential compression device for a client with limited mobility. Let me know what you guys think in the chat. I'm just catching up, so I'm only reading like half of the comments, and someone said eat, but it stands for evaluate, assess, and teach. But I'm hungry too, so I could eat. I could eat. I actually always can eat. Good job, guys. Lots of good answers. Just a reminder that you can visit us at uworldnursing.com to see our full event calendar for the next couple of weeks. Last week, a lot of you guys were asking for pharmacology questions and pharmacology prep. So we have a couple of those I think next Tuesday or Wednesday for a question drill for pharmacology. And then we have a lot of cool things coming up with concept maps. So check us out at uworldnursing.com to see what we're covering in the next couple of weeks. Also, you can drop in the comments what other subjects you guys would like to hear. Now that we're doing pharmacology, what are some other things? I know y'all are going to say maternal and peds. I always love maternal and peds. Let's see what else, guys. You guys might need extra help on, especially with the school year starting soon. Let us know, let us know. Cardiology. I think we have an EKG or ECG lecture coming up soon too. Someone asked, do you only do these questions for RN only, or are there blended RN and LPN? Our lives are only for RN, but we do have an LPN section and resources and subscription on our website at uworldnursing.com. Okay, so correct answer for this one would be options 2, 4, and 5. So all of these things, 2, 4, and 5, would be things that the LPN can do. The LPN can measure a client with heart failure for anti-embolism stockings. That's just measurement. They can do the measurement and get stockings. Option 4, administer enoxaparin to a client who's receiving skeletal traction. Again, they can administer medications. They can't do IV push, but they can do subcutaneous, which is what enoxaparin is. And then option 5, apply sequential compression SCDs. Sequential compression devices for a client with limited mobility. Again, that goes in with option 4 with that perfusion and trying to help them prevent a DVT. So that is totally okay. They cannot, like I said in the beginning, create an end. So option 1, create a plan of care for a client with chronic stable angina. That is something that the RN has to do. They create, they initiate, and they always end. So option 3, select discharge teaching topics for a client. That's the end of the teaching. So that is also in the scope of a nurse. But you guys did it very, very good. People are saying NGN case questions, please, and peds, and cardiology, and psych, and psych, and psych, and NGN. I'm hearing you. I see you. We'll work on it. Okay. Last question of the day. The nurse and unlicensed the unlicensed assisted personnel, UAP, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? Option 1, assist a client to the bathroom for the first time following surgery. Option 2, feed a client with dementia who has a serum glucose of level 70. Option 3, explain why incentive spirometer use is important to a client with postoperative pneumonia. Or option 4, take vital signs every 15 minutes on a client who was just transferred from the post-anesthesia recovery unit. Let me know what you guys think in the chat. Also, let me know how many questions out of 8 you guys got today. I feel like a lot of you did very, very well today. So I'm always glad to see that. And y'all are learning so much. So it warms my heart. Let me know what you guys think in the chat and how many questions out of 8 you guys got right today. This is not a select all that applies, so it's only one correct answer. Someone says RN have to do the first times. This is right. This is true. True, true, true. We got some 5s out of 8, 7 out of 8. Someone tuned in late, so they got 1 out of 4. You're learning, you're learning. 8 out of 8. Someone knows that they got this one right. Correct answer is option 2. Feed a client with dementia who has a serum glucose level of 70. So the UAP, activities of daily living on stable clients. So this client is the most stable, that doesn't require any further assessments, that doesn't require any initial assessments after coming back from a different unit or anything or surgery. So feeding a client with dementia who has a serum glucose level of 70, while that 70 looks like it could be concerning, feeding them will probably bring that blood sugar back up. So we're totally okay for them to feed the client. Option 1, assist the client to the bathroom for the first time following surgery. Again, since it's the first time, the nurse should be the person that does that first assessment, that first interaction or intervention to assist them with to the bathroom so we can make sure there's no complications happening. Option 3, explain why incentive spirometer use is important to a client with postoperative pneumonia. Explaining or doing any initial teaching, again, goes to the RN. And then option 4, take vital signs every 15 minutes on a client who is just transferred from the post-anesthesia recovery unit. Again, this is an assessment that is going to be ongoing. So, and especially someone that just came out of surgery and is going to a PAC or came from the PACU, we want to be closely monitoring for any complications, looking at any dressings, looking at any things that could be wrong so we can intervene immediately. So those every 15-minute vital signs, that is something that the RN should be doing so they can be the first hand of any interventions that might be needed. But you guys did very, very good. Thank you guys so much for tuning in. So glad to be back with you guys, and I hope you learned something new. If not, we'll go live with Nurse Andrew tomorrow at 7 p.m. for his Friday session, or on Sunday at 7 p.m. again with Nurse Andrew, or next week again with our multiple times on Tuesday, Wednesday, Thursday, Friday. Lots of times for you guys to tune in to get those free resources to practice for the NCLEX. So I will see you guys next week.